Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 23th topic. Case Report of TMD. 23. Case Report of TMD. Contents. Case 1. Malocclusion caused by mandibular fracture. Medical history. Treatment plan. Treatment results. Case 2. Occlusal interference from non-functional cusp. Cause and treatment method. Elimination of occlusal interference. Case 3. Malocclusion resolved by simple occlusal adjustment. Case 4. Complex occlusal adjustment required. Case 1. Malocclusion caused by mandibular fracture. The patient is a 35-year-old male. His chief complaints are a feeling of unstable occlusion and difficulty chewing. He requested the fabrication of a mouthpiece to make biting easier. The right image shows the initial impression. Due to a fracture of the right mandibular condylar neck, the mandibular midline is deviated to the right. In centric relation, only the left and right sevens and the right lower three make contact. No other teeth have occlusal contact. Medical history. Around 2nd or 3rd grade, he fell and hit his lower jaw hard, experiencing pain for a month but leaving it untreated. After that, he began noticing a clicking sound in his right jaw joint. After leaving it untreated for 2 to 3 years, the sound stopped. Around his 2nd year of high school, he fractured his maxilla when his bicycle collided with a bus. He underwent surgery at an oral surgery department. The upper right photo is the panoramic X-ray taken at his initial visit. There is a difference in length between the left and right mandibular rami. This discrepancy is thought to be caused by the fracture sustained during his elementary school years. Treatment plan. A simulated occlusal adjustment was performed on the models. The results revealed that by reducing the black shaded areas red arrows on the upper right model, specifically on the left 7 and right lower 3, stable occlusal contacts could be achieved for all teeth except the left lower 4 blue arrow in centric relation, as shown on the lower right model. The occlusal state set as the treatment goal is not ideal occlusion, leaving room to consider orthodontic treatment or surgical intervention. However, even if the patient were to achieve occlusion closer to ideal, the benefits gained from such occlusion would not justify the effort and expense the patient would bear. Therefore, we recommended to the patient a treatment plan to complete treatment with the occlusal adjustments at the 3 locations mentioned above. Treatment results. As shown in the model on the right, both left and right molars achieved stable cusp-to-cusp contact in the centric relation. Discomfort was resolved, and chewing ability improved. The occlusal disorder was judged to be completely cured. Below is the postoperative panoramic X-ray. Case 2. Occlusal interference from non-functional cusp. The patient is a 68-year-old male dentist. His chief complaints are severe sensitivity to cold and heat in the lower right 7th tooth and pain during occlusion. No abnormalities were noted on the initial X-ray of the upper right region. At the patient's request, a treatment plan was established involving anesthesia, pulpectomy, root canal filling, and crown restoration. Upon removing the amalgam filling, a front-to-back direction crack extending to the pulp chamber was observed in the crown region. This crack reached the pulp floor. The pulp was in a state of chronic inflammation. The right lower X-ray image shows the tooth after root canal filling with a temporary crown in place. Cause and treatment method. During right lateral movement of the mandible, occlusal interference was observed at the lingual cusp of the right mandibular 7. The lingual cusps of mandibular molars are non-functional cusps and typically do not contact opposing teeth. When the mandible moved laterally, contact at the lingual cusps of the mandibular molars induced nocturnal bruxism. Repeated strong horizontal occlusal pressure on the lingual cusp of the right lower 7th tooth due to nighttime bruxism led to the development of a crack in the crown. The upper right photo shows the state after resolving the occlusal interference on the 7th tooth, where similar occlusal interference has now developed on the lingual distal cusp of the right lower 6th tooth. If left untreated, this condition could lead to crown fracture of the right lower 6th tooth, similar to the 7th tooth, or cause periodontal disease. Therefore, the lingual distal occlusal surface of tooth 6 was reduced. This resulted in smoother canine occlusal guidance, eliminating the discomfort during occlusion and the teeth grinding. Elimination of occlusal interference. Illustration A shows the molars in normal occlusion with cusps interlocked. Illustration B shows occlusal interference occurring at the arrowed area of the lingual cusp during mandibular lateral movement. Illustration C shows the interference removed, enabling normal lateral movement. Occlusal adjustment is a minimally invasive procedure involving the removal of a portion of the enamel on the occlusal surface, provided the area of occlusal interference can be identified. However, identifying this area of interference is not straightforward. Occlusal adjustment is performed after determining the specific location and extent of reduction based on examination, analysis, and diagnosis. There is no place for a trial-and-error approach in occlusal adjustment. Case 3. Malocclusion resolved by simple occlusal adjustment. The patient is a 38-year-old male. The chief complaint is a feeling of unstable occlusion accompanied by mental illness. The red markings on the left upper 4th tooth's mesial marginal ridge on the right upper model indicate occlusal interference in centric relation. The black-filled areas on the occlusal surfaces of the left upper 2nd, 3rd, 4th, and 6th teeth on the right lower model are the sites where occlusal interference in centric relation was eliminated by simulated occlusal adjustment. After reducing the occlusal interference on the left maxillary 4 and 6, new occlusal interference developed on the lingual surfaces of the left maxillary 2 and 3, necessitating their reduction. The red area on the lingual cusp of the left maxillary 6 is the cusp tip, therefore, the occlusal fossa of the mandibular 6 was reduced. This occlusal analysis revealed that this occlusal interference could be resolved through relatively simple occlusal adjustment. This case is considered to have developed occlusal disease due to insufficient occlusal adjustment during the placement of crown restorations on the left upper 2, 3, 4, and 6 teeth. Case 4. Complex occlusal adjustment required. Next, we present a case requiring complex occlusal adjustment. The patient is a 53-year-old woman. Her chief complaint is severe temporomandibular joint pain. The cusp contact position is deviated from the centric relation, resulting in no anterior tooth contact at centric relation and overall occlusal instability. The black diagonal lines on the occlusal surface of the lower right model indicate areas reduced during a simulated occlusal adjustment performed to stabilize the occlusion. It became clear that these occlusal adjustments would ultimately be necessary to achieve a stable occlusion. During the actual occlusal adjustment, the model is shown to the patient to explain the areas to be reduced. After obtaining the patient's understanding of the treatment plan, the adjustment is performed while confirming the reduction sites on the model. Note that sometimes the treatment goal cannot be achieved with occlusal adjustment alone. In such cases, the patient becomes a candidate for so-called oral rehabilitation, which involves reconstructing the entire occlusion. Standard occlusion theory for TMD. 23. Case report of TMD is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 24. Case report of open bite.